Dr. Zhitnitsky, we did talk just a minute ago about the gum disease, periodontal disease, gingivitis, all those things. Anyway, we talked about the devastating effect it has, ruining liver, kidney, diabetes, all those things, and etc. Now, what can one do to fix it? What's out there? And, gum disease surgery, like all dentistry, unfortunately, which is maybe a reason why people stay away from, it all has a bad reputation, probably from 50 years ago when it was maybe hurting and bloody and all kinds of things. But has dentistry improved in the area of gum disease and, well, in this case of gum disease as well?
There is definitely good news. A lot of people who have gum disease don't need surgery, or they may need limited surgery. And the fact that we do surgeries with special instruments and lasers, it's much less traumatic than it used to be in the old days. Plus, on top of that, there are brand new treatment modalities. There are ways to treat gum disease without surgery.
Such as?
There's a wonderful new system. It's called Perio, which involves patients wearing special trays with medicine a few times a day. Now, it may be a little inconvenient that you have to put medicine in your mouth and wear little transparent trays, but it's definitely much better than surgery, and it controls bacteria that causes gum disease.
It's like wearing an Invisalign orthodontic appliance for a couple hours or so, right?
Yes, absolutely. About 15 minutes at a time. And it actually has been proven to kill the bacteria that causes gum disease. And it minimizes your chances of having surgery, or maybe in some cases eliminates those chances.
Because, more and more, of course, everybody at all given time, we all know that going under the knife, even for a little thing, if you can avoid it, you want to avoid it. I mean, people try to avoid taking blood, if possible, too often, do you know what I mean? If just for millions of reasons, so this would be a good thing. Who qualifies for that? People with slight gum disease, or would it be applying for people who years ago still needed surgery also?
A lot of people qualify that may have had surgery to maintain their cases, or people who just been diagnosed with gum disease. But the most important thing is go see a dentist right away, ask the questions, get a nice diagnosis, have the doctor explain everything to you, because the longer you procrastinate, the worse it becomes.
Right.
So my first advice is definitely do it sooner than later.
Right. Dr. Zhitnitsky, here's what I hear quite often from dentists who diagnose periodontal disease, call it aggressively, because you know what? I mean, if I would be a doctor, hearing what I hear from you and from other, doctors, if you do not put your fist down with the patient when it comes to periodontal disease, which is totally different, and you like crooked tooth, fine. You like discolored teeth and don't want to put veneers and on it, fine. That is not structural and systemic breaking you down. Gum disease kind of kills you, at least will make your life very difficult in areas you probably never even connected. So here's, however, what I hear from many dentists. A new patient comes to them. He has not been with them. He has been with another dentist for 20 years. And all of a sudden, the new dentist says, you have periodontal disease, you need some type of periodontal surgery, mild, minor, whatever. And the patient goes, really? Why would I? I was just 20 years with this chap, and he moved out of town, or he died, or whatever. Or I moved out of town. I moved from Colorado to God only knows where. Why would I need that? The other guy never even mentioned it. And I hear that a lot. So makes me believing that there is a fair amount of dentists out there who simply do not diagnose periodontal disease the way they should, I guess. Tell me if I'm wrong here. I mean, I'm not trying to flag down some dentists here. I'm just saying it seems to be that even some dentists do not know the severity of it.
You're absolutely right. Some people think that that everybody has it. It shouldn't be treated, or chances are that patients are going to lose their teeth anyway, and it turns out to be sort of a self-fulfilling prophecy. If you have a disease that you don't diagnose, you don't treat, we don't apply the same standards to cancer. God forbid if you're diagnosed with cancer, if you don't treat it, you will die, but you do want to treat it.
Well, I mean,
Same
obviously,
thing with gum disease, and
yeah.
especially gum disease. If it's caught early enough, 95% of people don't need any surgery. Mm-hmm. It is no more traumatic than getting regular cleanings, mm-hmm. or maybe putting some medicine around your gums, mm-hmm. or regular mm-hmm. checkups. So this is how I can stress that you have to catch it early. You have to go to a qualified dentist that actually screens for gum disease. In fact, right now there is screening that actually we can check if you're genetically predisposed to having gum disease. So this is a serious condition that people take very lightly, and if you don't treat it, you will have more problems. It's not something that you can leave for later.
Right. Well, any time you put something at a big gateway of something. Gateways are there because that's what they are, gateways. They lead to somewhere. And a mouth, with no doubt, is the gateway to the whole body. Nothing enters the bloodstream faster than when it comes to the mouth. And it's exactly that area which is infected. And people are not taking it out. And because it is that area, because it's not visible. In fact, it has the same color. The gums are already, only a professional sees the different reddish, because the whole gums are reddish. So reddish, I mean, what do I know what reddish is reddish? Bloody reddish, you know what I'm saying? But it just, and you're right. People bleeding, no big deal. Everybody bleeds. Why wouldn't you? And as some say, well, you don't say that when you brush your hair. You don't say, well, basically the mouth should not bleed, and if it does, you are infecting it. You're slowly dripping, poisoning your body. And it can be fixed with not so much pain.
Yes, it can be fixed atraumatically. A lot of times patients don't need surgery. It's a very easy solution. It just requires a little time on behalf of the patient and a qualified doctor. And Wonderful. It's not painful, and it's not traumatic, and people should definitely consider it.
Thank you very much, Dr. Zhitnitsky.
Thank you, Helmut.